Hey everyone, welcome back to Pain to Par, the YouTube channel where we turn physical setbacks into comebacks so you can get back to doing what you love. For me, that's golf. So today is the week 2 update. I'm going to give a quick update on the intensive 12-week program I've recently started to heal my degenerative disc disease, sciatic pain, and hip arthritis. So let's get stuck in. Okay, so just a quick review of the 12-week program. It's made up of 3 parts, 3 months. I'm still in month 1, which means I'm going to the clinic 3 times a week. And I've already met with the physiotherapist twice now to review and to add some exercises, of which I'm going to show today. Plus, there's always a weekly consult with Dr. Zielonka, which includes whatever he feels I need. And this past week, it was really just a bit of a chiropractic adjustment and a bit of a discussion on, how I'm feeling and any trigger points. So, other than that, the program's going well, and have a few updates for this. Okay, so let's start with what I do this week. I went in for 3 RLD sessions, so that brings it a total of 6 out of the 24. And I did meet with my physiotherapist again once, so that's 2 out of the 4. Managed to get to the gym almost every day, so I'm trying to get to the gym every day where I can do at least 10-20 minutes on the treadmill because it's winter in Ottawa, and so the roads are still a little crappy and uneven terrain really just wreaks havoc with my hip. So I like going on the treadmill and just walking, and then doing my stretches and some throwing in some resistance training. So I managed to get in almost every day, so that was good. In terms of how I'm feeling, I said that sciatic pain's getting a little better. I think this week I'm really going to try hard to track just every single time I feel some sciatic pain and log it. I do think it really depends on what I'm doing. If I'm sitting at my desk, I will say this: it used to be just sitting down for a little while, I'd start to feel it, and that hasn't happened in a while. At least I think it's been a couple of days for sure. So I'm optimistic that the robotic laser spinal decompression sessions are helping to relieve that pressure on the sciatic nerve. So I do think there's been some progress. The hip is I still feel a bit of pain in the hip socket. I think really due to the exercises that I'm doing, and we're going to go through all the exercises I'm doing, so you'll see why. In terms of lower back pain, twisting still hurts and it's pretty stiff, especially in the morning. And so I don't think there's really much change there. And in terms of range, I've added a bit of a new kind of update this week, which is just range of motion. So I'm going to track if I'm just trying to bend straight from my back and try to touch my toes, how far do I get? And so this week, I'm at about 6 inches from the floor, and I used to be able to put my palms on the floor. So I know that there's some room to improve, and I actually have a bit of a video of that. So let's go there now. So I figured one of the things I should do is at least start tracking what kind of flexibility I have. So this is week 2. I do feel better. So I'm just going to go until it starts to hurt in my lower back. And then every week I'll just do another one of this. So that's about as much as I can go. I can get it farther if I really push, but this is where I start to feel it. So we'll see what happens next week. Okay. So as you can see, it's I can feel it just as I start, getting past horizontal, and hopefully I'll be able to show that it's getting better. So let's start. Let's move now, and I want to show you the exercises that I'm doing. Okay, so that's where I'm at in terms of my range of motion. I may add some other ones, like I was thinking about hip external and internal rotation, so I may start to add those in as a way to track. But generally speaking, overall, I'm feeling pretty good. So I wanted to go over the exercises that I'm doing. So these were provided to me. Now, remember, each person's going to have their own exercises and stretches that are geared to them. For me, I have lower back pain, right? So my L4, L5, I have lower back pain. I have hip osteoarthritis in my left hip. So a lot of what's going on here is uh, these stretches are geared towards strengthening the glutes, the lower abs, the pelvis, and the spine. So the first stretch is the single knee to chest. You hold it for 30 seconds. Next is, I'm lying down and the knee goes across the chest, and I hold that for 30 seconds. The figure four knee to chest is okay when I'm crossing my right leg, but it's really hard to do any rotation with my left leg because of the arthritis. So that one is essentially that right leg is actually on the ground, and I'm just doing like a figure four that way. And hopefully, I will start to be able to lift the leg toward my chest. And then the trunk rotation supine, that's just super comfortable. It's like it is painful as I'm twisting because I told you it hurts, but it's really good. I do that easily a couple times a day now. I'll go into the basement, my little gym, and I'll do these. I call them trunk rolls, and I'll do also the a thoracic spine stretch, which is the next one, the trunk rotation supine. And so those are working really well. The hamstring, that's really just, leg goes up, and then I guess it's called dorsiflexion. So it's really trying to stretch out the hamstring, and then the lying face down doing the quad stretch. That's fine on the right. On the left, it really hurts. Again, I think it's because of where my arthritis is. It's right at the front of the acetabulum. So, if I'm lying down and I'm pulling up on my left leg, I think it's pushing the femur towards the front. And then the QL stretch, I do it against a door frame. I found a YouTube that's like, it really works well. So I do the door frame version, and that's the stretches. So I do those once a day. Sometimes I'll go back and do it in the evening. And now I'm doing. We met this week to add some exercises. So now I'm doing these pelvic tilts, lying pelvic tilts, abdominal hollowing exercise. So really, it's all about just pushing my lower back into the ground as much as possible. And then these abdominal hollow leg arm extensions are essentially dead bugs, but it's so there's 3 sets. I do it the first set without any weights, the second set with weights, and then the third set I lift my head up with the weights. So that's a bit of a progression. And then the next one is these one-legged bridge dips. Those are really, really now. I'm doing it only on the left side to really try to activate my left glute med, as I've been told. And that's because it's, given the fact that I have the arthritis there, it's probably not firing as much. Like the rest of the body's compensating. So that one is really, really tough. I find myself after the 3 sets kind of like shaking. And then the hip abduction side lying, same thing. It's only for the left side. I'll probably start throwing in the right side just to make sure things are equal. But in general, those are the exercises. And again, it would be tailored to your specific needs if you're going through the same program. Okay, so that was in essence where we're at this week. So making progress, feeling pretty good, and yeah, and I thought I would throw in, given that for me, what I'm trying to get to is back to golf. I went to the golf simulator last night just to hit the ball around a bit, and I did notice some interesting uh, things with my swing. I'm really not I'm really not shifting my weight over to my lead leg, and I know why, because it just hurts the hip. So I'm gonna flip over to that video, and we'll take a look, and I'll show you what I mean. Okay, so this is me at our local. We have this dome. Again, it's winter, right? So you just can't go hit anywhere. We have a dome that doubles as an indoor soccer field, but they take half of it during the winter and turn it into a driving range. So here's some head on, and I'm just having trouble posting or shifting my weight to the left side, the lead side, because that's where my hip arthritis is, and I think it's forcing me to, or the result is my weight staying a little bit more on the back foot, and I'm not transferring as much weight, and I'm losing some distance. So I'll show you what I mean in a second. Okay, so let's move this back a bit to here, and we'll just start. So overall, I think I'm pretty happy. Well, I probably could. I think it's a little too far forward. I'm trying to do this. When I'm setting up, I'm trying to do this like straight line. I'm trying to make a straight line, but that's a little too much. The this line, I'm supposed to try to, that would be the line, right? And it's not. So that's a little too much. So I got to fix that next time. But so I'm taking it back, I think that's pretty reasonable in terms of, transfer, turning well, I feel. Now I am doing a bit of a weight shift, but I feel like right around there, like my lead leg should feel like I'm pushing off of it. If I transferred my weight, I should be right here. This part here, I think I should be pushing off of it and straightening out, like getting my left butt cheek to be up and back behind me, and instead it's not. It's still pretty flexed, and I just feel like I should be. It feels like I'm behind the ball, almost like a driver instead of over it, and I think that's I'm losing some distance, and I'm kind of see how it's bent there. I feel like I really just feel like it's bent. It feels like it should be straight, but maybe. And then I kind of straighten up as I'm finished. But yeah, that's what I'm going to be working on. So hey, thanks again for tuning in. And if you're new to this channel and you want to follow my progress as I try to get back to some pain-free golf, then hit the subscribe and click the bell. And as always, I want to give a big shout out to the Ottawa Chiropractic and Natural Health Center. That's Dr. Zielonka and his great team that are that's where I am going for my intensive program. And yeah, so again, thanks very much, and I'll see you in the next video.